next.
Hey, Mr. Chairman, thank you very much. And Dr. Murthy, we're grateful to be with you again and to commend your exemplary public service at this difficult time for the nation. I probably will get one question in because I know you have to go. I wanted to start with something that I proposed in early 2020, just weeks before the pandemic. I called it the 5 freedoms for America's children. The freedom to be healthy, the freedom to be economically secure, the freedom to learn, the freedom to be safe from harm, and the freedom from hunger. And then I put that in a piece of legislation that we introduced not too long ago. But I was thinking about those 5 freedoms for America's children when I was considering the advisory, and that children's mental health doesn't exist in a vacuum. It's largely impacted by their family, the community, their societal circumstances. We know that poor socioeconomic conditions can create unhealthy stress both for a child and their parents, and can lead to adverse childhood experiences that are known to put children at risk for harms later in their childhood or much later in life. You said on page 4 of your testimony, quote, "Systemic economic and social barriers like safety, housing, food, and economic insecurity contribute to and create the conditions for poor mental health for young children." I wanted to ask you, just in terms of proposals going forward, as we discuss a broader, more holistic response to youth mental health needs, what broader policies to improve the well-being of children and families should we consider?
Well, Senator, thank you for that thoughtful question. And I like how you framed these 5 freedoms for American children. It reflects, I think, a really powerful reality, which is that there are many factors that impact the mental health of our kids. And food insecurity is one of them, economic insecurity, homelessness. These are all important issues we have to address, because I think for a child to be well, they need to have secure attachments, good, strong relationships in their life. They need to have safety. They also need to know that the future has a place for them. They need to know that they belong. They need to know that the future is bright. And many children look around them. They see the violence in their communities. They see the threat of climate change. They see the specter of racism and discrimination. And they wonder whether that's really true, whether the future truly is brighter for them, whether there really is a place for them. I think it is our obligation to address these issues, to create a healthier, more hospitable society and home for our children. We know these broader existential threats, in addition to the more immediate economic threats that families face, are really influential when it comes to the mental health of our children. So I think this is so much bigger than making sure our children have access to care. They need that. This is more than ensuring we're investing in prevention programs in schools. It's about recognizing the broader environment in which our kids are growing up has a profound impact on their mental health, their relationships, their economic security, their safety, as well as our ability to address these broader challenges like racism, climate change, and violence. This is what will help our children have a foundation for good mental health going forward.
Doctor, thank you. And I'll submit a question for the record on Medicaid, in particular integrating physical and behavioral health for children, but I'll do that for the record. Thank you, Mr. Chairman.
Thank you, Senator Casey, and thank you for your passion for kids especially. Doctor, you're right on the clock at the hour to let you go, and I'm going to do that with just one additional question. And first, let me just say thank you again for being here with us. You